It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, welcome to a special edition of The Sam Lesante Show. In fact, this is a very important show, my friends. You know, this COVID thing is really driving people crazy, confused. It's just a sad thing. So I'm not going to labor that point, but I'd like to keep you updated on what's happening and getting true facts. Today we're going to talk to John Fletcher, who is the president of the Lehigh Valley Hospital Hazleton, and also the vice chair of the Department of Medicine, Dr. Lenko. She's been on the show before just to give us some information, just review some things so we could get on track. Listen carefully. Information will be on the screen. There's some confusion going on, and hopefully we'll clear that up today, okay? Let's talk about the vaccine, the effectiveness and the safety of the vaccine. I've spoken to people in the last few weeks. Half of them don't want to get it. Half of them are getting it, okay? Let's talk about that.
So yeah, we started at Lehigh Valley rolling out the vaccine about a month ago, and it was mostly, as everyone knows, to the first responders, to our healthcare workers, and then to our skilled nursing facilities. So we started that about a month ago, and like you said, there's a lot of questions about the vaccine, and I get it every day with my own patients. But there are two vaccines, Pfizer and Moderna, both of the manufacturers, and we are offering both of those vaccines at Lehigh Valley. And they are incredibly safe and incredibly effective. So the main thing that we've seen that's been super surprising for us is how effective they are. We talk about like an effective vaccine for the flu, and every year it varies somewhere between 40 and 60% of preventing flu cases every year on a normal year. This vaccine, these two vaccines in the early trials have 95% effective rates. So that means they're just incredibly effective at preventing getting COVID infection. So we've been rolling this out, and to date, Lehigh Valley Health Network has vaccinated close to 18,000 people. And I was fortunate enough to receive my second vaccine last week. So now I'm fortunate as of today. I will have, fortunately, the 95% vaccination in my body, fortunately. So
you said that it's incredibly effective. Okay, now how do you know that?
So they basically looked at, they did study trials of lots of patients, hundreds of thousands of patients that they had volunteers for in the summer of this past year. So they enrolled participants. We at Lehigh Valley had about over 300 participants of volunteers in the Pfizer trial. Moderna did their similar trials, and what they looked at, they gave half of the patients the vaccine, and half of the patients what they call placebo, or non-vaccine, an injection, and just watched and waited. And they waited till they had a certain number of COVID cases in those in that group. And what they found when they got to a certain number, around 100, they looked at who had the vaccine and who didn't, and 95 of those 100 patients had not had the vaccine versus 5 of those patients that had the vaccine. So that's how they get to that effective rate.
Where does the vaccine come from?
So the vaccine right now is initially from the manufacturers, which are the Moderna and the Pfizer. Those are then sent to the state health departments. So it's important to know that we don't get control of what we ask for from the company. We can't go directly to Pfizer right now and say we want 3,000 vaccines. We are getting the vaccine directly from the State Department of Health, so the Department of through Pennsylvania, and they are controlling, exactly who gets the vaccine and how much. So as much as we would like to roll this out on a big scale, some of it we are waiting and asking and trying to get as much vaccine as we can that we can also safely administer to our patients and to our colleagues.
So is Lehigh Valley Hospital prepared to distribute to the community?
So we're working through that phase now. So right now we were talked about a little bit about the phases. So we are in phase 1A according to the state, and you can find this on the Department of Health.
We're going to show that
Yeah.
as you're talking. Explain the phases because we're going to have it on the screen.
Right. So
Okay.
phase 1A is for healthcare workers, is for hospital workers, EMS, first responders, things like that. In addition to that, phase 1A is also our skilled nursing facilities, our nursing home residents, and our assisted living home residents. So we are working through those groups now. Lehigh Valley has also picked up some of those nursing facilities as well. They were initially slotted to be with CVS and Walgreens, but some of that has been a little delayed. So we are working through some of those groups, and I know 4 of our local facilities are getting vaccinated by Lehigh Valley this week and early next week. So that's phase 1A. We are almost through what we mean, Lehigh Valley is almost through the majority of who we feel is offered the vaccine in that group. So we are trying to get into the next phase, which is the 1B. That 1B phase it includes any patient 75 and over, and then another longer list of essential workers, grocery store, postal workers, firefighters, et cetera. So we're moving into that, but we're not quite there yet, and we're waiting for the state's approval and guidance as we move into that phase.
And then what's the other phase?
Then the next phase is phase 1C, which includes a lot of patients, a lot of people with health problems. So you might not be 75, but you might be 50, but on chemotherapy. That's that type of patients, along with other essential workers, engineers, legal, finance, information technology, that type of group. Finally, there's phase 1D, and that's basically everybody else.
Walk our viewers through what they should do to either get a schedule to go and get the shot, because I tried myself and I was a little confused.
Right now, it is frustrating, and patients have lots of questions. What we're telling patients that do not fall into the nurse category, the healthcare worker, physical therapist, if you are one of those people, physical therapist, and regardless of where you work, you don't have to work for Lehigh Valley to get a vaccine through Lehigh Valley. So if you are one of those people, we encourage you to go onto the website and the Lehigh Valley website. You are in the category of the phase 1A that could get it right now. For everybody else that's not sure, we're encouraging you to log on to your portal, which is mylvhn, the portal. That way, that'll give you access to when your group of people, whether you're 75 and over, when you are eligible, there will be ultimately messages that appear that says, okay, now it's time to schedule your vaccine. Right now, we're ramping up. We have larger scale clinics at the vaccine clinics that are mostly based at our hospitals, Cedar Crest, Muhlenberg, Pocono, Schuylkill, and Hazleton. And we're evolving that, where we know we need to have multiple venues for this. Again, some of it is limited by the state. The state has certain regulations that you can only have an approved site for a vaccination clinic. So we're in the process of rolling out a bunch of different clinics at various sites, but that process is ongoing.
So if I'm in one of the plans, okay, if I'm in plan 1B or 1C, when I register, where do I go and get the shot? Does it tell me where I go?
Yep. So once you register on the app or on the computer through my LVHN, it will direct you to a list of sites and a list of appointments that are available. And again, this week we might have 10 sites. Next week there might be 20. We're also looking at larger scale venues of trying to get this out to a much larger population, knowing that we eventually have to help vaccinate the community as well. So we're looking at a lot of different options, but unfortunately right now we're asking everybody to keep looking on the portal. And if there's something pops up there that says schedule your COVID-19 vaccine, by all means schedule it, and I encourage everybody to do so.
All right, so you schedule it, and then you go to the specific, either the hospital or one of the areas will they tell you where to go?
Correct. You'll get an option. You'll get an option about where you want to go.
And do you register option, the hospital hit that, and then
you'll get an option for the hospital, the location, but what you won't get is an option for which vaccine. So we encourage people that you don't necessarily get to choose which vaccine, because we don't. They are both available, but not always. We don't always have. We get what the state ships us.
Now, how do I know which vaccine to get?
I would get either. It doesn't matter.
Well, I'm just saying. I mean, both of them equal as far as effectiveness is concerned.
Correct. The main difference for us is how it's stored, how it's handled. There's a few differences on the healthcare side and the administration side of it. But for the patient, these two vaccines are very similar. There are 2 more vaccines in the pipeline that are not yet approved in the United States, AstraZeneca and Johnson & Johnson, we think, but not approved yet. They are different types of vaccines.
So when I go and get the vaccine for the first time, okay, the two vaccines that you're talking about now, you have to get 2 shots, right?
Correct.
So they'll indicate, okay, your next shot is due in whatever.
Yep,
okay.
exactly.
All right. What are some of the symptoms of COVID-19?
So the symptoms of COVID-19 are similar to what we've been talking about all along: cough, fever, aches. A lot of people get a headache. A lot of patients recently have been having stomach symptoms, nausea, vomiting, diarrhea, and the classic symptom that we talk about is loss of taste and smell, but not everybody gets that. So that is one of the
So what do you
concerning.
do when you get those symptoms?
So the best thing to do is to call your healthcare provider. There's many resources on Lehigh Valley's website to access nurses 24 hours a day. There's e-visits that you can do through online video visits.
What do they give you? What are some?
They're giving you, just if you're not sure if you need to be tested or not, because that's the ultimate thing, if you need to be tested. And we still have our 2 testing sites, both in Sherman Court downtown and Hazleton near Vine Street, and also over at our Coordinated Health in Humboldt at Station Circle. So there's options for testing, but we are only testing patients with either exposures or symptoms. All right,
so you're tested positive. So you quarantine, you get medicine. I mean, what is the survival rate? Is it, because everyone's so scared. If I get it, I'm going to die. Okay.
So the survival rate is very good. Most people will recover from this. Over 99% of people will recover from COVID infection. About 15% of people that we see that get COVID in our whole population end up being hospitalized for it. And unfortunately, in the nursing facilities, that number is much higher.
It's higher, yeah.
So there's not a lot, unfortunately, of medicines that we are using. There is a monoclonal antibody.
So that's the real reason why you should get the vaccine.
100%.
That is major. I mean,
Yeah,
and I know people are nervous about it, but hey, as I said, I'm the biggest baby, but I'm getting a shot. Okay. All I can tell you, you're doing a fabulous job. I mean, the Lehigh Valley Health Network has always been excelling in different things, and I'm just excited about what you guys are doing.
We are thrilled to continue to help, but all we can do is encourage as many people as possible to get vaccination when they're ready. I know a lot of people are excited. Some people are hesitant. I will say the potential mild risks of the vaccine, which last potentially, if you have a mild, flu-like symptoms afterwards, lasts for 24 hours. Way less than COVID infection.
Before we go to break, is anyone getting flu anymore?
It's a good question. So we have not seen a lot of flu cases this year, and that's because we kind of expected that.
Yeah.
Social distancing, not a lot of large gatherings. Masks, hand washing, and flu is much less infective than COVID. So we think if we were going to stop COVID, we figured we were going to stop flu. Not a lot of flu at all.
Well, Dr. Lenko, keep the good work up.
Thank you.
I'm going to go to a break, and then I get the real man here, the boss of the area, John Fletcher. He's going to give us an update, folks. Remember, all the information is on the screen. Just pay attention to it, follow the instructions, and stay healthy, as they say. We're going to take a break. We'll be back right after this. Welcome back to this special edition of the Sam Lesante Show. Very important show, my friends. We're giving an update on COVID-19. If you just tuned in, we run this show a number of times. Our website, ssptv.com, and also the Lehigh Valley Hospital Network, their website. We're talking about an update of COVID-19. We just interviewed Dr. Lenko, and now we're interviewing the president. No stranger to the Sam Lesante Show, John Fletcher. John, how are you?
I'm doing great, Sam. How are you?
I'm hanging in there.
Happy New Year.
Thank you. Same to you and your family.
Thank you.
I'm getting ready to get the shot. Okay. I'm proud of you. You got your shot.
I did.
See? I thought I was the only big baby afraid of needles, but you are too.
No, I think I'm ahead of you.
Oh, yeah. I want to tell you, one of our family members had COVID, and we had to take him up to the emergency room. And I can't tell you enough. I've said this many times. People are getting probably tired of me saying this, but from the receptionist to the people that work there, okay, and Dr. Weaver, she was absolutely fabulous,
Exactly.
Okay? And I want to tell you, my friends, when I talked to a doctor and he says, Sammy, no matter how old you are, whether you're 30, 40, 50, 60, 70, 90, they don't give up on you. It's not
Never.
like, you see, some people think, well, he's 90, 92, 93, they do the same thing, John, okay, and I'm so impressed with that. I mean, you got a fabulous staff up there.
Thank you, and you're spot on. I mean, they're so caring and compassionate about what they do. I mean, they truly believe, and they are taking care of their neighbors. Every single person that comes through that door, they treat as a family member, and you can't ask for anything more. We have a fabulous staff.
And they pay individual attention to everyone who's there. You're not grouped in, it's each individual person gets their own what needed to be done.
It's incredible. I'm so glad you had that great experience.
And
you've had it
sorry
many
to,
times.
yeah, I mean, but Dr. Weaver, I mean, I got to tell you, she was absolutely, and fabulous. I mean, everyone there, it was great. Well, I just wanted you to know that. COVID-19, give me a community update.
Yep. So Sam, it's I'm looking at this as a light at the end of the tunnel, and so we talk about 2021, and when I'm up on the floors, we talk about how 2021 is going to be a great year for us. It really is. I think it's 2020 started out great and ended really. It was a difficult year. 2021, we're going to start out. It's going to be a tough start, no doubt about it. But I think we're going to end 2021. It's just going to be a fabulous year. We're looking forward to it. So where are we at the hospital? As expected, we continue to see a high number of patients at our outpatient testing center, and we still see a high number of positives. We are not out of this at all. We still need to do all the things that we've asked. On the inpatient side, we're in the 30s. And so that we haven't seen that drop on the inpatient side. In fact, we as expected, given Christmas, given New Year's, struggled a little bit with what we needed to do, family gatherings. We saw an increase in our inpatient census. Dr. Villette, Tony, he would absolutely say to me, here's what we should expect based on what I'm seeing. And he was spot on with our census. And so we're still in the mid-30s. But when we look at our models, we always talk about the data. We're looking at the outpatient number of people we're testing. We're looking at the positivity rate. We're looking at the calendar as to how many weeks outside of the New Year or Christmas. As a network, we expect 2 or 3 really difficult weeks. We're not expecting it to drop, but then we're going to start to see it. We're going to start to see the decline in our inpatient census. That's what we're predicting. And so when I tell you that I see a light at the end of the tunnel, I truly mean it. On top of that, the vaccine. And so when you look at where we are, we introduced the vaccine. We're beginning to vaccinate members of our community as well as our staff. We're through the holidays. It's beginning to, I look for the good, and I'm seeing a light at the end of this tunnel, and I just can't wait to get there.
Yeah, you and millions of other people.
Absolutely.
Well, Dr. Lenko explained the different plans. And so when do you think a majority of the community, all people that are qualified or register, would it be the end of February, the end of March, the end of April? I mean, what's the timetable
Well,
here?
I'll tell you, we'd love to have it by the end of February or end of March, but it's out of our control. I mean, it is dependent on the amount of vaccine we get. We are gearing up, as Dr. Lenko said, we're gearing up for when we're able to roll it out. We don't want to start the planning process. And so we're planning now, but that's really beyond our control. We got to have enough vaccines, as Dr. Lenko mentioned. The Department of Health is truly is the one that delivers us the vaccine. But I will promise you this, as a network and as a hospital, when they tell us go, we're ready to go. And so it will not, as soon as we get the word thumbs up, get going, it'll be not a matter of weeks, not a matter of even days. We'll be ready to go as soon as they give us the green light.
So we explained how you register, looking at the portal, and we try to make it as simple as possible for those people. But We also listed the plans. Okay, you know who really qualifies if you're 75 or older, if you're sick or whatever. So those things are all explained to you. Don't get frustrated, but just follow those particular plans. You always have a message to the community, and you've been spot on every time. And sometimes I wish you weren't spot on in some of the things. I wish you were wrong, but unfortunately you were right for the right reasons. Okay. So what's the message as we continue to community? And I said we're taping this January 13th. Things will change. Right. We run this show a couple weeks, But what do you tell us?
So, a couple key messages. One is the vaccination process. That's what I get questions. My cell phone is ringing every day. Go to the network. That's the best place for the up-to-date information regarding vaccinations. And that changes. It changes almost daily about where we are. So pay attention to the vaccination. Make sure that you're enrolled in the LVHN portal. Make sure you get that done right away. Get that done. And what I say to the community is, COVID fatigue, we talked about last time. Do not let your guard down. We are so close to that light. But if we give up, if we don't do what we need to do with the distancing and the mask and the hand washing, it's going to be a rougher trip, a rougher journey to that light. And so I asked the community, this is it. When we were coming down that last stretch, let's double down and let's really get there and where we need to be. The faces, when people are getting vaccinated, whether it's a hospital staff member, they're all wearing masks. But you could see the smiles, and I had a colleague from the network say, the line for the vaccination, it's a line of hope. And when you truly look at that, it's a line of hope. And it gives people that sense. And that's what we're all looking for. And it's there. And so I just asked the community patience regarding the vaccine. Follow what we need to do as it relates to the things we've been doing since day one. And we're going to get to the end of this and have a great 2021.
I hope you're on target with that as well. What happens is people read and hear that they're distributing these vaccines, and they're thinking that, well, all I have to do is go and get one, okay? But you're saying you're limited as to what you get. Okay, now how do they decide what networks or what hospitals get the vaccines?
Well, that's a good question, one that I can't answer because it's done by the Department of Health. But so when the other thing I want to stress is when people are signed up for the vaccine and they have an appointment, you have an appointment. There is a vaccine for you.
Yes.
You do not need to arrive an hour and a half early.
Yeah.
Because that's a problem because we have that.
Sure. Yeah.
But at the same time, if you arrive without an appointment, we're going to have to turn you away because we only have the vaccines that we have are already committed to those who are scheduled. And so we really don't have that level of control of saying how many vaccines we're going to get this week or next week. We work very, very closely. The network works very, very closely with the Department of Health. And so we have an excellent relationship. And I'll be honest with you, I think we're doing a pretty good job with the vaccinations. I know the frustration out in the community.
Yeah, sure. Yeah.
But it's a well thought out with physicians like Dr. Lenko, who's sitting on the committee with the network to talk about the vaccination plan. We're lucky to have that representation, and we're lucky to have the support of a network and the commitment from Lehigh Valley Health Network.
There's no question about that, John. We're very, very. It's impressive. I talked to Tony with Dr. Valent this morning, and I said, is the book done yet? Because remember he said, Sammy, we don't have a book on this. He was so right, because every time everything changes, I said, I hope you're coming to the final chapter of this book, which it's
And what
amazing.
Did he say?
He says, I think we're getting there. He said, I think we're getting there, Sam. But I always say, I think one of the most intelligent things that I heard Dr. Flynn says when he says, Sammy, we don't have a book on this.
Yeah,
And and that's why these things were changing. And people say, wait, you told me this now. And that's what happens. It changes so fast, Well, I can tell you, John, again, I don't want to be redundant. Hats off to all of you people.
Thank you.
Really, and you're concerned. And that's the thing that I feel the best for a lot of senior citizens is that you're concerned about them. It's not fake. It's not phony. It's you really are concerned about their health, and that's important. Okay.
And one last thing, I just want to say a huge thank you to our medical staff and to the colleagues at the network, or our colleagues at Lehigh Valley Hospital, Hazleton, and the Wellness Center. Understand the fatigue they're going through. This is their second major wave. They're tired. They are very tired. But you know what? They get up and they come to work every day to make sure that they're taking care of our community. And we owe them. We owe them so much. It's just unbelievable.
The word is patience, my friend. The word is patience. Don't give them a chance. Give them a chance. They're under a lot of stress. We hope you learned something of this special edition of Sam Lesante Show. We'll see you next time.